Imagine having ADHD that's so bad that it's kept you from succeeding in school, literally 4 semesters at a time. Then imagine getting COVID-19 and the cognitive impact of that making things exponentially worse for you. That's what we're talking about today. This is the Hardcore Self-Help Podcast. I'm your host, Dr. Robert Duff. Today, I have a very short and sweet episode with a question about the impact of COVID-19 on ADHD symptoms. So be sure that you're subscribed wherever you watch or listen. If you have a question for the show, send me an email to duffthepsych@gmail.com, and let's just jump into it. All right, today's question reads, hello. So I'm getting my BSW, which I believe is Bachelor's in Social Work. I've had to push the start of my internship back twice due to starting ADHD meds and just kind of sleeping through the semester. I even fell asleep at nap time at work. It was so bad. But I didn't pass the prerequisite class. Then the following spring, I got long COVID, just kind of slept through the semester again. Both times I didn't advocate for myself. I just accepted failure. I don't like imposing or burdening people. I don't know. But I finally passed the prerequisite class last spring. I got ridiculously sick again, but I kept in touch with my professors and passed my classes with Bs. So I'm doing school social work at an elementary school. Really excited. I did my discussion board posts for my class that accompanies the internship and said that for fun, I just watched the same show I've seen 100 times because my ADHD is so out of control. I can't focus on reading, which I really enjoy. She commented asking if I had COVID previously because that can make ADHD worse. Love that for myself. But today she ended class early, so I caught her and asked her about the literature that she read because I was interested. She said that the studies compared it to getting a TBI and to do exercises for a TBI. I do remember you do something with the brain. For the life of me, I can't remember, but can you recommend any exercises to help? She also suggested getting accommodations through the university because of the ADHD and the long COVID. I opened the page and stared at it. I don't even know where to start. I don't want to be a bother. I also have like depression and anxiety and BPD. I don't even know. You're in California too. I attend a CSU. I read that as verbatim as possible with the uhs and stuff too. Anyways, thank you for the question. Hello. I really, really appreciate you writing in. There's a lot of info to get into here, but I first want to just give you some serious credit. You've encountered so many setbacks that could have kept you from moving forward with your degree. And while you've not advocated for yourself in the way that maybe you deserve, that full sort of way that I think you deserve, you have adapted and pushed through and put out a lot of effort to keep moving forward. Given what you're contending with, it makes it more difficult. It takes more mental effort and probably physical effort to achieve the same things that your peers do. A lot of people with cognitive or emotional issues encounter similar roadblocks to you and don't end up pushing through. Not a, statement against them, but I just want to praise your strength of character that's allowed you to keep pushing and keep going, and here you are. One thing that I want to point out right off the bat is that ADHD is very commonly comorbid, so coexisting with other mental health issues like depression and anxiety. You mentioned that you didn't advocate for yourself because you don't like imposing on other people or burdening them. To me, that signaled issues with self-concept, the way you feel about yourself, which is very, very common in ADHD. So common that it's often in the assessments that you take. So if I were to send home with you an evaluation where you fill out your symptoms of ADHD, somebody else might fill out the symptoms they see in you, one of the areas of focus would be self-concept. Please remember, you did not ask for ADHD. You also didn't ask to get long COVID. These things are not a flaw of your character, and they're not just because you failed to try hard enough. These are legitimate differences in the way that you operate within the world. And those differences don't fit with the typical model of school very well. So there's a reason why you're fighting these struggles. If you had a classmate, say with type 1 diabetes, right? They were born with it, they've had it their whole life, or multiple sclerosis, I'm sure that you wouldn't apply the same standard to them if their condition limited their ability to focus or to be present in class, to pump out the kind of work expected by everybody else in your course. I think you would be a little bit easier on them about that. I'm sure you know all of this, but I just really want to encourage you to give yourself some grace, give yourself some credit, because even though it feels like you might not be trying hard enough, I believe that you've been trying as hard as you can, given the hand that you've been dealt, and I think you're doing a good job. So let's get a little bit more into the meat of your question. You mentioned that one of your teachers or supervisors mentioned that COVID can make ADHD worse. We're still learning a lot about this, about the acute and chronic impact of COVID-19 on physical health and cognitive functioning. I did a little bit of a literature review, so looking at the research for ADHD and COVID in preparation for this. And there are a lot of studies that are looking at how the early pandemic, like the lockdown stage, was associated with greater symptoms and greater struggles in people with ADHD. But there wasn't a lot out there looking at specifically ADHD symptoms being exacerbated by COVID-19 infection. However, we do know that post-COVID syndrome is actually quite common. Post-COVID syndrome, long COVID, sort of interchangeable. One study estimates that about 35% of patients that have been treated for COVID in an outpatient setting, meaning at your primary care doctor or something like that, show residual symptoms that last, and up to 80% of people are over in hospitalized populations. So if you were hospitalized for COVID, there's up to an 80% chance, or actually over 80% chance, that you're going to have lingering symptoms. Post-COVID syndrome isn't only present in people that had severe COVID infections either. It can happen even if you had relatively mild symptoms. Some of the common physical symptoms of post-COVID syndrome or long COVID are fatigue, headache, and changes to smell. A lot of people feel that they've lost their smell or that their sense of smell has changed. And cognitively, you see somewhat different impacts for the acute phase, meaning right after you were infected, and then the chronic phase for later on. For the early phase, declines in memory are common, as well as some issues with language, like finding the right words when you're talking, and executive dysfunction, so trouble with executive functions. And for the chronic phase, which they consider in the literature to be 12 weeks post-infection, you see more attention difficulties, so more focused on the actual ability to pay attention and focus in on something, as well as some memory difficulties and, again, executive functioning. So a little bit more of a shift toward attention for that later phase. So, even if there aren't data tying COVID infection to specifically making ADHD symptoms worse on a neurological basis, you can imagine that adding on some of these cognitive declines that happen with COVID to an individual with ADHD already is just going to make things more difficult. Even the physical symptoms can make an impact. For example, let's say that you have a hard time maintaining attention for extended periods of time during class due to your ADHD. Maybe you find it exhausting to put that much mental effort towards staying focused. And then after your COVID infection, you find that you're simply exhausted all the time. You might not have as much effort to put toward pushing yourself to pay close attention during lecture. Similarly, just the prospect of getting started on work that you've been procrastinating or getting to a task that you've been putting off can seem monumentally more difficult because you have that physical fatigue, let alone the cognitive side. I think attention difficulties are pretty self-explanatory. We have issues with short-term attention, long-term. The real issue with ADHD is that kind of sustained attention where you're trying to pay attention to something and focus for a long time without getting sidetracked or without making a lot of mistakes. So people with ADHD might have trouble with vigilance, meaning they can try to focus on something, but they're going to miss information coming in. Or they might have hyperactivity where, they're bouncing around a lot and they're not able to keep their focus in one place for very long at all. But aside from attention, I also wanted to define executive functioning a little bit. I know I've talked about executive functions on the show before, but it's a term that I hear thrown around a lot. So I just want to make sure that you understand it. Executive functions are a group of skills, a group of cognitive skills that are primarily managed by the frontal lobes of your brain. And these are higher level thinking skills. Think of the frontal lobe as the executive of your brain. It doesn't necessarily do the grunt work, the processing or the memory part, but it directs and manages the rest of the brain like an executive. So executive functioning includes things like selective attention, meaning can you attend to this while filtering out that, right? Can I talk to you and look at my notes while filtering out the fact that my kids are yelling at each other over Minecraft in the background? It also manages multitasking, or what we would call mental flexibility, the ability to kind of switch between tasks without losing your place, without getting stuck too much. Working memory, which is the ability to manipulate information in your mind. So if I told you to think about your route from where you're sitting right now to the bathroom through your house or wherever you are, you would make a mental map and you would have to kind of mentally organize that information and manipulate it. Or if you were to do mental arithmetic, that would require working memory where you have to manipulate the numbers and give some sort of output. And then organizational ability, which is pretty straightforward, being able to organize your thoughts, being able to put a sequence together. People with really poor organizational ability might be able to do similar things to other people, but they do it in a way that's a little bit less of a logical flow. And so it takes more sort of brute effort from them. Now, school and work typically require a lot of executive functioning. And while it's not actually part of the formal diagnostic criteria for ADHD, meaning executive functioning deficits are not in the list that you're going to look at, we know that people with ADHD very commonly struggle with executive functioning. It's like an associated symptom. So all that said, I would not be surprised if having symptoms of long COVID has made your ADHD more difficult to manage. You talked about watching the same show 100 times in a row, and that's super common among people with ADHD. And there's a few reasons for it. For one, people with ADHD are prone to hyper-focusing on things. Whether it's a specific food or a television show, they might be stuck on it until it's replaced by a new target focus, which could be weeks, could be months, could be years. Also, when you've watched the same thing many, many times, you don't have to pay as close attention to it because you basically know it by heart. So it doesn't monopolize your attention. In other words, it doesn't take your attentional effort. It doesn't drain that resource that you don't have so much of. So it feels easy. It feels safe, maybe even comforting. You said that your professor mentioned studies that have compared long COVID to getting a TBI or a traumatic brain injury. And I think there's some validity in that. Just like a TBI or a stroke, really anything that impacts the brain physically, the impact of that can be varied depending on to what extent, exactly where the brain was impacted, like what location. It's really common for people who have experienced even mild traumatic brain injuries to have some disruption to the speed of their processing and their attention ability. And then also fatigue and headaches are really common. So yeah, there's definitely some overlap there between them. We don't fully understand the mechanism behind long COVID-related cognitive issues, but we think that COVID can invade the nervous system, the central nervous system, meaning your brain, spinal cord, through the olfactory pathway, so nasally. And it also may weaken the blood-brain barrier, basically what protects your brain from outside interference. And so by weakening the blood-brain barrier, the virus can actually enter the brain, which leads to inflammation and damage to the neurons, which are the cells that communicate in your brain. So yeah, if you've had long COVID and you're concerned that things have changed for you cognitively, it's maybe not just in your head. That's a bad term, right? Your brain is in your head, but you're not making it up. There's possibly a real neurobiological reason that things may be different. And when it comes to exercises that you can do to help, there are some things to consider. I would say aside from just looking for cognitive rehabilitation or skills practice for these specific things you're trying to get better at, you would also want to look more broadly at your habits and your environment. There are a lot of really good therapists and also executive functioning coaches out there that can help you develop better systems that can help manage your ADHD better. So there are some things that you can do, like there are some apps that have been demonstrated through research to help with attentional functioning or information processing speed. They can help you train that skill. But I kind of worry for your situation that if I give you an exercise like that to focus on, that is going to be a distraction to help you procrastinate on other things that you really need to do. So I absolutely think that you could and should use accommodations at your university. I don't mean this in a rude way, but your question drips with ADHD. The way that it's written, the way that you hardly knew what you were talking about by the time you got to the end of it, I definitely think that you have ADHD that's at a level where, yeah, you could use some help for it. And there's nothing wrong with that. You need more support than you're getting right now. You're not really being fair to yourself. The disability office on your campus, if there is a physical office, is there for a reason. You're not putting them out by trying to get help. That's literally what they're there for. You probably wouldn't consider anybody else a burden for asking for help with these accommodations either, right? So I don't know what makes you so different. Obviously you're different, you're special. So it's a problem that you're doing it, whereas other people, it's totally within their rights. No, you deserve to get the help. And that experience you mentioned of opening the page, the website, and being overwhelmed and not knowing where to start, that's totally understandable. ADHD can sometimes make it difficult to get help for ADHD. So even on that front, you might need a little bit more support for that stage where you're trying to figure things out. If you do have an actual disability office on campus, I think that it would be great for you to set up an appointment or walk in and actually talk to them, because they can help point you in the right direction and give you a little bit of a roadmap for getting the ball rolling on accommodations. Some schools themselves do provide testing and evaluation, and for others, they have to refer you out to somebody in the community like me to do that type of testing. And it could be really enlightening for you, going through the evaluation, understanding where your strengths are, where your weaknesses are. I think it could be a valuable process aside from accommodations. But typically, college campuses or colleges, they have some criteria that are required in order to get accommodations for something. So you're definitely going to want to talk to the disability office, whatever it's called on your campus. You also need to make sure that you have a therapist. I don't know if you do or not, but you could use a therapist. Ideally, somebody with a specialty in something like cognitive behavioral therapy who specifically works with ADHD. Obviously, as we talked about before, there are a lot of self-defeating thoughts, and I see people-pleasing tendencies going on here, and those are getting in the way of you helping yourself. So you need somebody to challenge you on that and keep you pushing forward. They may also be able to help with some of those strategies that I was talking about, things to help you manage your ADHD symptoms. Similarly, they can help you tease apart the issues that you're having. Like you were asking about cognitive improvement strategies, but maybe they can point out some other things, like maybe you have horrible sleep hygiene, you don't ever get out into the sun, you're using a super inefficient strategy for studying, your physical space is chaos, your mental health symptoms are out of control. This is all hypothetical, but if those things were true, working on those is going to be way more impactful than some sort of cognitive exercise. You're going to get a lot more bang for your buck that way. So please do get yourself some additional support. You're not doing anything wrong by struggling here. You're not burdening anyone. Your first step is try to get in contact with disability services at your school and talk to somebody. You don't need to know everything already. They should guide you through the process. So just go, let them know you're struggling with these things, that you haven't known how to navigate it, and they can help you from there. After that, or concurrently with that, you need to make sure that you're working with a therapist. There are various ways to get a therapist. I just did an interview last week with somebody from Two Chairs, which is a really great option if you're in one of the states that they service. You can also just go on Psychology Today or any other therapy finder, plug in your info like your insurance and things like that, and then put in the people that you're looking for. So you can click box for CBT, you can click a box for ADHD, and that will help you find people that can actually help you out. And I could give you more of a roadmap as to where to go from there, but I don't want to overwhelm you, right? This is keeping ADHD in mind. So disability services, find a therapist, that's where you're going to start. These may lead to other referrals, but don't worry about that right now. Disability services therapist. And that's it. It's going to help you out. Yes, it's possible that your ADHD has gotten harder to deal with the long COVID, but you're going to be okay. There's a lot of things that you can do from here, and I believe in you. So thanks.